Namaste. Asthma is a chronic condition that affects millions of people worldwide and can significantly impact their quality of life. Fortunately, medical researchers and practitioners continue to explore new ways to manage and treat this condition effectively. It is important to be aware of the various treatment options available today so that you can manage the condition better and need not bear with the difficulties of the condition. As we commemorate World Asthma Day this week, we are very happy to have with us Dr. Vishwambar Vallabhaneni, Consultant Interventional Pulmonologist at Apollo Specialty Hospitals OMR, to help us understand this topic at depth. Dr. Vishwambar has an extensive experience in treating various respiratory conditions, including that of asthma. Without further ado, let's dive into the topic and learn from his vast expertise in this field. Thank you for joining us today, Doctor.
Welcome.
And welcome to the FP Live. Let's start with a basic question, Doctor. What is asthma? What happens to the body when you undergo or when you suffer from asthma?
See, I would want to start everything on a positive note. Everybody thinks that asthma is a disease. Yes, agreed. Yeah, medically, yeah, you want to discuss about that. It is a disease, chronic inflammation. Too much of terminology goes into that. But I would like to simplify that by saying asthma is a condition which is coming through the family. That is, it is usually having a genetic predisposition. That is the first thing you will have to know. So whenever I say genetic predisposition, the way we are is from our parents. So the genes, whatever we are talking about, the way our eyes, the nose, the body parts are there, it's basically from our parents. So I would like to say that there are some conditions which do traverse in this parental lineage. So asthma is one such condition. I would never want to tell my patients or anybody that asthma is a disease. That itself puts them down. Because see, when you treat asthma, it's as a condition, you will have complete reversal of your symptoms. So that itself gives them a positive outlook, saying that it is a reversible condition. So it is something which is chronic. Yes, it comes through the family, but it stays with you because it is there in your blood, it is there in your genes. It comes and goes because of some triggering factors. So I would like to always say that asthma is a condition which is related to allergy, most likely, most probably, and it is usually parental.
So what happens to the airway during an asthma attack, Doctor?
The airway goes in for constriction. I would like to explain it a little more in detail. See, there is always airway and lung parenchyma. So all of you must be knowing about breathing in. Yes, you breathe in through your mouth or through your nose. So when you breathe in, this air goes through your throat. All of you know the throat part, right? So there is a tube called trachea which carries the air into your lungs. In the same place, there is a tube called esophagus, or you can call it food pipe, which takes the food into the stomach. Both these tubes are present in your throat part. The air pipe or the trachea goes down exactly in the central part of your chest, that is in your central upper part of the chest. It divides into two branches, a right branch and a left branch. Each ends up in the respective lungs. That is, the right branch ends up in the right lung and the left branch in the left lung. From this point on, these airways divide multiple number of times, approximately 20 to 25 times they divide. It is just like a road getting divided. So this is just like a roadway, we call this as an airway. Now, asthma is a condition which purely affects the airway. It is not a condition which is affecting your lung parenchyma. Parenchyma is that part where the air goes and diffuses. That is, the oxygen goes inside and it diffuses into your bloodstream, and the carbon dioxide which is generated in the body again diffuses back into the alveoli, that is the lung parenchyma, which again is carried through the airways, like the roadways, please remember, and then comes out. So basically asthma is a condition which affects the communicating part of your lung, which is the airway.
So what are the signs and symptoms, Doctor, that one can identify saying he or she is under an asthma attack?
The first and foremost symptom would be tightness in the chest. Okay, they will have some congested feeling in the chest or tightness in the chest. Then would be cough, which can be dry or sometimes even productive. But classically, most of the times the productive cough gives out very scant and button-like sputum, very scant and button-like sputum. You have to remember that. And then you can have breathlessness. In severe cases, yes, they do have wheeze. That is a sound or a musical sound which comes out of the chest when you breathe in or especially when you breathe out. These are the usual symptoms of asthma.
Are they associated as a predisposition condition of cold or cough or fever?
Yes, usually what happens is asthma will have triggers. The triggers can be environmental, they can be in environmental you have organic triggers, inorganic triggers, and definitely yes, one side of the spectrum has microorganisms, out of which there is bacteria, there is viruses, and there are parasites and fungi also, which can cause exacerbations in asthma. So exacerbation is nothing but, see, asthma is a reversible condition. So there can be scenarios when the patient is completely asymptomatic. So during these times, if the person gets exposed to the virus, say for example your influenza virus or your H1 or your COVID virus, during these times when the virus enters into the lungs, the airway of the lungs gets sensitized. That is, the airway of the lungs becomes inflamed and it gets sensitized and sensitive rather to any of the external stimuli. They get sensitive to cold temperatures, they get sensitive to the food you eat, they get sensitive to even a dust which you are getting exposed to, for which usually you don't react. So the viral infections and bacterial infections, yes, do predispose you. They are one of the triggering factors of asthma.
So is asthma genetic, doctor? And who is more prone to get asthma?
Yes, definitely asthma is genetic. Most of the times asthma is genetic, because allergies, I will want to tell you in a more simplified way that you can understand. There is allergy which is there in the blood. Allergy is not a condition which is confined to one particular organ. So allergy is in the blood, and so it can affect your skin, where you can have it, call it as dermatitis or eczema. Allergy can affect your nose, where you can call it as allergic rhinitis, itchy nose, blocked nose, runny nose, itchy throat, itchy eyes. Allergy can affect your airways, wherein we call it as reactive airways, or we call it bronchial asthma or an bronchial allergy. So this is how it can be. So it is usually definitely parental, or we can call it genetic, and it is always transmitted. And any patient you take usually can have any of the allergies in combination. For example, 70% of the asthmatics do have allergic rhinitis, and 40% of allergic rhinitis patients do have bronchial asthma. So that's the relation.
What are the various risk factors that may lead to asthma, doctor?
So the risk factors can be age, yes, usually the active age groups, and ages when there are hormonal changes, especially just before the menarche. Asthma can either, the symptoms of asthma can reduce, or the asthma per se can increase during these times. And age groups when the person is usually active, that is professionally active, where he is dealing with some chemicals, or when he is dealing with more of dust and dusty environments, they will be more prone. Old ages, yes, when people are not properly treated in the form of inhaler medications during their younger age group, they end up having severe asthma during their old age.
Whom should we meet to get treated for asthma, doctor? Is it an allergy specialist or a pulmonologist?
A pulmonologist who has good or significant practice experience in allergy would be the best choice, because we are dealing with bronchial allergy, and that will require both expertise from allergy as well as pulmonology.
So we'll take a couple of questions in between, doctor, from our viewers. Hello, doctor. I've been suffering from asthma for the past 2 years, and the problem intensifies during early morning at late nights as well. Why does this happen?
Yeah, this is the classical presentation of allergic airway or an asthmatic airway. The reason for this is fall in temperatures. Usually early in the mornings and late in the nights the temperatures fall, and the second reason being that you can have fall in your levels of steroids, that is the corticosteroids, which are naturally secreted in the body, the levels of which are usually down in the early mornings. So most of the asthmatic attacks or the asthmatic symptoms are predominant in the late nights or in the early mornings.
My 16-year-old son is asthmatic, and we recently did witness a couple of changes in him. I have read that exercise can also help in treating asthma. So, is that true? Should I be worried?
Yeah, exercise is good for asthma, yes, but exercise induced asthma also is there. That is another variant of bronchial asthma. It's called exercise induced asthma. Usually, after starting the exercise in the first 5 to 10 minutes of exertion during a sporting activity, say for example, your son is a basketball player or a football player and he had to sprint during the sport wherein he has to run. So during that episode, in the initial stage of the sprint itself, usually they experience the symptom of severe cough or wheeze or breathlessness. Yeah, that is called exercise induced asthma. And the best way to treat that is to take reliever medications just 5 to 10 minutes before the start of the sporting activity. We can see a lot of sporting legends who have asthma and who have been using these inhalers just before their sport.
Doctor, is there any relationship between age and asthma? Does asthma as in worsen as the age progresses?
I would say yes, asthma affects all ages, especially I have already mentioned to you that there is something called childhood asthma, there is pregnancy induced asthma, there is late onset asthma which is usually in the 40s. Till 40s the patient is completely asymptomatic. We are recently finding this variant to be very predominant in the city crowd. Up to the ages of 40 they are completely asymptomatic. Only at the ages of 40s during the decade, fourth decade, they usually start experiencing the symptoms. When we go back in their history, family history especially, and ask them, is anybody in your family allergic? Do they have any allergic symptoms like eczema, dermatitis, or allergic rhinitis or bronchial allergy? The answer would be yes. And this variant is called late onset asthma. Yes, it can happen. So all ages basically are affected with asthma. Your second part of your question is asking us whether as the age advances, does the asthma become worse? If the patient is not treated with inhaled medications early part of their life for their asthmatic condition, yes, these people do end up becoming COPDs. So COPD will have similar symptoms of asthma, but the point here is the symptoms of COPD are permanent and progressive, whereas the symptoms of asthma are reversible and they are not progressive. So yes, they do tend to become COPDs if they are not treated as the age advances.
So early detection is the key.
Is very important.
Yeah. Doctor, what are the latest advancements in the treatment of asthma today?
Yes, we have advancements. The first advancement which has happened in the entire medical field, I would say that's the path-breaking or ground-breaking advancement is direct deposition of the drug in the site of problem. That is inhaled medications, or rather we call it inhalers, or in the colloquial language puff or anything like that. So these inhaled medications are path-breaking or ground-breaking. Once they were started, inhaled medications came during the 80s and late 70s and 80s. But once they start developing the type of inhaled medications also changed. The chemicals used, the drugs used in the inhaled medications also went in for a huge advancement. Initially we had only short acting medications which used to act for 2 to 3 hours. Now we have medications which act for 12 hours. In the recent past, in the last few years, we had seen medications which act for 24 hours. So you take it once a day, yes, you are done with it. So single day dosing medications are also available. Apart from these, we have medications which can also treat the cause of asthma. So now we have divided, so basically the meaning of asthma in Latin means that hunger for breath. It is not the name of a disease. Please remember this, asthma is not a name of a disease, it's the name of a symptom. So it's just like fever. So what are the causes of fever? It can be malaria, it can be typhoid, it can be any other thing, right? It can be COVID, it can be influenza. Just like that, what is the cause for this asthma? There is eosinophilic asthma, there is neutrophilic asthma, there is lymphocytic predominant asthma, there is exercise induced asthma. So there are a lot of variants. Each variant needs to be treated in a specific way to get an ideal treatment, to get an ideal outcome rather. So that way, yes, there are different varieties of asthma, so they need different varieties of treatment. So this concept is very new in the present scenario. We have developed this concept of asthma phenotypes in the last 4 to 5 years, and we started treating patients based upon the phenotype of the asthma.
Doctor, what is biologic therapy for asthma?
Can you elaborate? That is one of the, yes, that is, it's a good question actually, very important rather. After the phenotypes of asthma have been identified, the first one to be identified, almost the first one to be identified, is eosinophilic asthma. An asthmatic condition where there is increase in eosinophilic count, that is absolute eosinophilic counts being more than 200 to 300. So these patients fall into that eosinophilic asthma. Their sputum tests also reveal that they are predominantly eosinophilic in nature, the sputum analysis, and their serum Ig levels also were evaluated, which showed that the Ig levels are abnormal in range, probably more than 600 or 700. So these patients fall into the category of eosinophilic asthma. And these patients require something called biological agents. So preferably, see, biological agents need not be prescribed to every eosinophilic asthmatic patient. The first line or the main line of treatment for asthma is always an inhaler therapy, which is more, which has been studied and for a long time, and it has no side effect profile, or I would say rather very meager side effect profile, which could also be eliminated by taking the drug in the right form. And it has been long standing, its usage and its therapeutic effects have been well known to us. So the first line of treatment is always the inhaler therapy. Patients who are not responding to ideal inhaler therapy can be given biological agents. Biological agents, remember, are add-on therapy. But the advantage of biological agents is patient symptom control will be predominantly well managed compared to the inhaler therapy in patients who are not responding.
Are they administered as shots or as oral medication, doctor?
All the biologicals we have omalizumab, we have benralizumab and mepolizumab right now. These are the three biologicals which are available in India today, and all of these medications are given only as subcutaneous formulations. That is, you give it into the skin as injections.
So do they have any side effects while undergoing treatment?
See, talking about side effects, every drug has side effect. So we would like to rather frame it in such a way that the patient can understand it, in the sense that we have to always balance between the benefits we receive and the side effects. So taking that into consideration, we would always say the side effect profile of these biological agents is almost close to negligible. Yes, you can have very few patients who complain of having some allergic reaction to the biological agent itself. We are giving this, yes, we know we are giving it for an allergic condition, but still some people, very few patients, probably 2 to 3% of them can develop an allergic reaction to it at the site of injection, where there can be itching, redness, and usually biological agents do cause a slight fall in the immunity of the patient. So whenever the patient has any infection or is more prone to infections, we would just give them a little caution about the risk of infections. This is the only side effect profile as of now.
Doctor, would you be continuing to take asthma medications along with the use of these biological agents?
Asthma medications, yes. Biologicals, I have already told you, are add-on medications. So
yes.
the mainstay of treatment still remains the inhalers. Even during the intake of the biological agents, usually the treatment is lifelong with biological agents also. So the reduction, there is definitely a considerable reduction in the usage of inhaler therapy when using biological agents. That is the advantage. And definitely patients who are dependent on oral steroid therapy. So that is the main advantage. So in patients who are eosinophilic asthmatics, that is having eosinophilic asthma, and who are dependent on oral steroids or high dose steroids, these patients will have a huge benefit using biological agents. But inhaler therapy is a must.
Doctor, coming to the next form of treatment, can you elaborate a little bit about bronchial thermoplasty, please?
Yeah, as the name suggests, bronchial thermoplasty. So thermo meaning heat related. Okay, so basically using an instrument called bronchial thermoplasty, the procedure is bronchial thermoplasty, the instrument is bronchial thermoplast. So the filament is put inside the tracheobronchial tree with the help of a bronchoscope, and it generates heat energy which is disseminated into the bronchial smooth muscle. because that is the place where bronchial constriction happens in asthma and causes severe intractable Vs. So in carefully selected patients who are not responding to or who respond very meagerly to inhaled steroids and inhaled and oral steroids, this subset of patients are selected for bronchial thermoplasty, because bronchial thermoplasty takes time, it is not an instant treatment, and also it is expensive. And such patients are selected, and this bronchial thermoplasty is applied on their bronchial smooth muscle, which helps in ablation of the bronchial smooth muscle. Once the smooth muscle is ablated, now there is no or there is very little bronchial constriction. So it is a more advanced treatment in bronchial asthma, but remember, advanced treatments are not for all patients. In closely, carefully monitored and selected patients, we use either biologicals or, if needed, bronchial thermoplasty. It is not for all patients. There is definitely separate subset of these patients in whom we use it.
Doctor, what is immunotherapy and how does it help asthma patients?
Immunotherapy arises from the concept of sensitization. Now, what is sensitization? So, you already have known the risk factors of asthma, like dust, it can be pollen, it can be sometimes nuts, it can be vegetables, it can be animal products like milk, eggs, fish, mutton, any of the animal products, or it can be dust in the form of the house dust, it can be dust from the agricultural side. So, there are a lot of agents, fungal agents. So, you need to, in immunotherapy, the first step in the treatment of immunotherapy is to identify the causative agent of the symptoms of that particular patient. So, we do something called as a skin prick test. Then we identify the causative agents. Once you know the causative agent, we are going to give immunotherapy. So, it means that that particular causative agent is given in minute micro doses by diluting it orally for a period of at least 2 to 3 years. So, every once in few months, the concentration of that particular agent which is given orally is increased. So, over a period of time, suppose say for example, there is a patient who is allergic to peanut. He eats one peanut, he starts developing severe allergy. So, that particular component in the peanut, allergen, which is causing the allergic reaction, is isolated and is made into a solution, and this solution is diluted probably 1000 times, 500 times, 100 times. So, initially to start with the treatment, we give him 1:1000 dilution amount of peanut solution orally. Over a period of time, we slowly keep increasing it. So, by the end of 3 years, it so happens that he takes a full peanut, the patient does not have any allergic reaction. And I would like to reiterate that immunotherapy is not for all patients, it is for very carefully selected few patients. It does not give effective results if it is done in most patients. I mean, nowadays we see people prescribing immunotherapy for almost all the patients. So, it is not that way, because you are not allergic to one particular item. You will be allergic to a lot of items from the animal kingdom, from the dust kingdom, from the plant kingdom, flower kingdom, from the pollen kingdom. So, there will be at least 7 to 8 allergens. You cannot treat 7 to 8 allergens together. But immunotherapy, when done in carefully selected patients, can give cure in asthma. That's a big sentence I want to say. It can give cure in asthma where no other medication can do it. All the medications in asthma only control the disease to 100%. Immunotherapy alone does cure. But remember, it is hardly less than 1% of asthmatics who can achieve this cure through immunotherapy. Please don't waste your time and money, because it is expensive, it is long term. The treatment usually goes to 3 years and above. Continuous treatment wherein you cannot miss doses of medication.
So, how do we know if we are eligible for immunotherapy, doctor?
Yes, so it is I would say on personal experience. We have to have some personal experience towards, say for example, there is a patient who says that, sir, I had gone to a restaurant and I had fish, this particular fish in childhood. So, I developed an allergic reaction, I was taken to the hospital, and after a few months again I had taken the same fish and I have developed an allergic reaction. So, it says that he is reacting to that particular item. So, then you need to come to a pulmonologist. We do an allergic testing. So, a skin prick test. So, we take the entire fish kingdom, the total protein, allergic protein which is available in the fish kingdom, meaning the seafoods. So we take that and test the patient by pricking it so that we can get a reaction on top. So we definitely now have a documented evidence of reaction to that particular agent. Or if the patient develops reaction to any other substance, then we start doing a skin prick test for that particular substance. And then, so why does this arise? The most easiest thing here is to avoid eating fish. Now there are people who say that, sir, fish is my staple diet. I have to eat fish, or I want to eat fish, I cannot go away with it. So in those scenarios, we do a skin prick test, come to know and document that yes, he is having allergy to seafood, and then we start giving him the immunotherapy. Once the immunotherapy is started, as I've already mentioned, it is a long-term process and he can achieve treatment. But remember, the skin prick test will not be done in each and every patient. It will be done in only carefully selected patient when the patient themselves say that he is allergic to one particular item. That way, you can achieve success in immunotherapy. If it is for multiple items, immunotherapy for multiple items is very difficult to achieve because your body has to have multiple doses of multiple allergens over a period of 3 years. Sometimes it may fail.
Doctor, does breathing exercises help in managing the symptoms of asthma?
Not when you have an attack. See, all the breathing exercises, whether it is yoga, pranayama or normal breathing exercises, are a strict no during attack. So once the asthma is being effectively treated, yes, as a prevention, yes, you can or you may use it. Is there a documented evidence? Yes, there are documented evidences which say that the lung immunity is good, the lung infection rate is reduced. But if you ask me, will the asthmatic effects get reduced? I would say with the help of medications, inhaled medications and breathing exercises, yes, definitely there is a benefit, but not during the attacks.
So how can we control these asthma triggers, doctor?
See, asthma triggers are some things which are available commonly in the environment. So I have already mentioned that they are organic and inorganic substances. So the organic substances include the dust which is organic, which is coming from dust mites. It can be mosquitoes, it can be cockroaches, it can be ants in some people, it can be fungi. So it's varied completely. It can be molds. Okay, these are all organic, and the inorganics are substances like perfumes, chemicals, which the person gets exposed on a day-to-day basis.
Agarbattis,
yes, definitely. Yes. Okay, that's very common in India that we use incense. So incense sticks also do produce that triggering effect. So these are all the risk factors or the triggering factors. We call these as triggers. So identify the triggers and try to be away from them. That is the best way to control your symptoms.
Doctor, what are the myths related to people having inhalers? There are a lot of myths surrounding it. Could you elaborate on a top 3 about?
Yeah, this is the most important question which everybody needs to get educated about. We have been shouting on the rooftop saying that inhalers are very safe, but the common myths of the inhaler. The first myth is inhalers are advanced treatments, so they should be used only in very sick and severe patients. That is the first myth. Now I want to tell you the fact with this myth. Inhalers are advanced treatment. Yes, 100% agree with that. They are most advanced. It is just like using an Android mobile phone compared to a normal landline phone. So it doesn't mean that there are too much of side effects in that. So it is ease of use. The medication which we are using in an inhaler is 1/100 or 1/300 of the dose of the oral medicine you need to use to control your asthma. Thereby you are reducing the dosage to a very minimal levels, so your side effects are minimal or almost negligible. And the second point is the point of action. So you are directly giving the medication into the place where there is a pathology or disease. So here you are not giving the medication into your stomach where it needs to go into the blood, then need to pumped by the heart into the target organ. So the target organ is directly delivered with the medication. So thereby reducing the dosage drastically and reducing the side effects caused in the other organs. So when you take a tablet for asthma, for example, you take a theophylline. that is Deriphyllin, most commonly used medication, you will definitely get gastritis because it is causing gastritis by irritating the gastric mucosa. But when you use an inhaler, you are bypassing that. That is the second advantage of using an inhaler. The third myth, the most important myth, is people feel that it is a permanent thing and they need to use it on a daily basis and it is addictive. I will say it is just like paracetamol for fever. So do you have paracetamol in your house? Yes, you can have paracetamol in your house. When do you use it? Do you have to use it daily? No, only when you have a fever. The same way, you have an asthmatic attack, you have a wheeze, you have a chest congestion, use the inhaler. You don't have it, please keep it in your house. You need not use it. So that is the most important thing. The next one is the people feeling that it is addictive. So you need to have a lot of science here. When the common people question, you need to have a little scientific questioning. Does it enter the bloodstream to go into the brain and cause addiction? No, it does not enter your bloodstream. It is locally acting in your lungs. Suppose it enters into your bloodstream, does it cause addiction? No, it doesn't cause addiction. It is not like nicotine in cigarette smoke, it is not like alcohol, or it is not like some of the psychiatric medications which cause CNS effects, that is effects on the brain. It has absolutely no effect on your brain. So it is not addictive. So these are the myths. Please follow them and try to understand.
Doctor, we'll take one last question from our viewer. My 16-year-old son is asthmatic and we did recently witness a change in his voice. Is voice change a common problem associated with asthma or the inhaler? And in continuation to that, doctor, will there be side effects or physical changes to a person while undertaking medicines for asthma?
Yes.
As in delayed milestones or anything in children in terms of body weight, in terms of look?
Yes. So I just want to mention here, the oral medications I have already mentioned usually have side effects. The local medications have negligible side effects. Now when I say negligible side effects, now what are these side effects which are negligible? There are only two side effects. One is oral thrush or oral candidiasis and change in voice, which is also called a dysphonia, change in the quality of voice. It can be hoarseness in the voice. So we are eliminating these two side effects also while using an inhaler by suggesting the patient to use a spacer. The second point, when the patient is taking a dry powder inhaler, he can get these side effects. So we suggest the patients to gargle their mouth after taking the medication. Thereby we are eliminating the side effects on the whole. So you will not have any side effects taking inhaler medications at all. The second part of the question is regarding, will there be any changes in physicality of the patient? I would like to suggest, say that during the pediatric asthma attacks, people having asthma during childhood, if they are not treated in the early childhood using inhalers, and when the disease is not well controlled, pediatric patients do fall short of their milestones. Say for example, a 6-year-old child is supposed to weigh, say for example, 15-20 kgs, he is going to be only 12 or 13. So he is falling short of his weight, he is falling short of his height also. So when you start treating these kids who are falling short of milestones with inhalers, in the next 2 to 3 years, they are going to gain back the entire weight and height which they have lost before or which they have not gained. Yes, they do gain good weight, ideal for their age and height. Okay, so that is the concept of giving an inhaler. So the lost milestones can be brought back. So that is a good intervention in terms of medical field, wherein usage of inhalers has no side effects but also has good effects towards other systems, helping in growth of the child.
Doctor, as we commemorate World Asthma Day this week, what would be your message to our viewers?
My message to viewers would be, you can control your asthma by only knowing well about your disease. You know your horse, you can win the race. So know more about your disease and also I want to correct myself, it is not a disease. I want to reiterate again and again, it is not a disease, it's just a condition which is familial. So know more about your condition and start using inhalers at an early age. Thank you.